Now, the first hospitals in the United States didn't exist until the start of the American Civil War. The first hospitals were built as very large warehouses where beds were lined up right up next to each other, sometimes multiple individuals on one bed. In these hospitals, diseases were actually transmitted quite more frequently than they would in the rural communities or countryside. As you can imagine, individuals who were sick with respiratory infections or diarrhea could easily contaminate patients next to them in adjacent beds. Again, there was no knowledge of microbes or how they could be transmitted at this time. Most doctors did, however, think that it was transmitted by bad air, which allowed for the ventilation and lighting of some of these hospitals, but still diseases were easily transmitted. Airborne diseases like influenza, tuberculosis, and measles were easily spread from patient to patient. That's why in today's hospitals, we have individual rooms for patients, and only in emergency situations like Ebola or the 1918 flu do we resort to these large open rooms. At the time, in fact, there was quite widespread knowledge that hospitals was where you would go to get even more sick. So a lot of people resisted going to hospitals. This was first coined by Sir James Young Simpson as hospitalism, but nowadays we refer to this kind of infection as a nosocomial infection. Nosocomial infections are infections that are acquired in a hospital. This still happens today, though thankfully people tend to go to hospitals to get healthy, and generally people do not get more sick. In the 1800s, around the time before and after the American Civil War, there were discoveries being made about how to more proactively take care of hospital patients. One of these individuals that was a pioneering member was Ignaz Semmelweis. Ignaz Semmelweis was a physician in Vienna, and he noticed that the death rates of women going to hospitals was in fact much, much higher than women that chose to give birth at home. In fact, many of the women that would die in hospitals would die of a disease referred to as childbed fever, what we now refer to as puerperal fever. Childbed fever, or puerperal fever, was a disease that we now know is a result of streptococcal infections. However, at the time, it was just associated with a horrible abdominal pain after childbirth that progressed to the entire body, eventually resulting in a system-wide failure of lactation, urination, vaginal secretions, fever, and eventually death. Ignaz Semmelweis was curious as to why so many women in the hospital were coming down with this childbed fever, and so few women at home were. In addressing or questioning the origins of this disease, he noticed that one of his colleagues, after performing an autopsy, had accidentally cut himself and, within a few days, ended up dying of what really looked like childbed fever. He wondered if all of the doctors who were performing autopsies and then wiping their hands on their gowns, going to the next ward, and helping deliver a baby were in fact infecting the mothers, their patients, with this disease. To test this, he required that his colleagues end up washing their hands with a chloride solution. This simple procedure of chemically washing hands took the death rate of childbed fever in his hospitals from 30%, or 1/3 of women, all the way down to less than 2%, a dramatic decrease. Though this was clearly shown to be extremely helpful, many of his colleagues didn't listen to his discoveries. And that was partly a result of his abrasive personality. He was so upset by the fact that this incredible discovery was not being utilized that he ended up being committed to an insane asylum and dying from an infection that was very likely a streptococcal infection, much like that he was saving so many women from dying from. Ignaz Semmelweis is now known today as the hero of mothers and the discoverer of the hand washing technique in hospitals. Hand washing is now considered a standard aseptic technique. Remember that septic means contains bacteria. Aseptic, then, is a technique that reduces the number of bacteria. And hand washing is one of the easiest ways to do that. The next pioneer that we want to address is Joseph Lister. Joseph Lister lived a little bit later than Ignaz Semmelweis, about the mid to late 1800s. And like Semmelweis, he was obsessed with reducing the mortality rate found in hospitals, specifically in surgery departments. He again recognized that there was an importance in reducing the number of deaths in hospitals by applying chemical antiseptics that would kill some microbes. He was in fact responsible for using carbolic acid, which is a type of phenol, in patients' wounds, acting as an antiseptic to help reduce the number of microbes that would get into surgical sites. He also promoted the concept of using these same chemicals to treat surgical instruments and hands as well. He was generally considered friendlier and kinder of a physician than Ignaz Semmelweis, and his ideas of aseptic technique, hand washing, and surgical instrument washing was more widely accepted as a result. And thus, Joseph Lister is credited for developing antiseptic or aseptic techniques. In fact, the mouthwash Listerine was named in his honor. Around this time as well, John Snow was also credited with a few important discoveries. In the mid-1800s, John Snow became a leader in the field now referred to as epidemiology. Epidemiology is the study of patterns of disease, and it allows scientists to understand where disease originates, how it is transmitted, and thus how to better battle and defeat the disease itself. Specifically, he was able to map and trace cases of cholera in London in the mid-1800s. He noticed that when he mapped out the cases of cholera in the streets of London, that they all surrounded a specific water source. In fact, cholera itself is transmitted by water. As a result of this recognition, he was able to identify the original source of this infectious agent and end up helping alleviate the transmission of this deadly disease. He did this subsequent to that first outbreak with a second outbreak of cholera in the city as well. Now, all of these cases of the pioneers of modern microbiology generally did not use what we now refer to as the scientific method. As a result of not using the scientific method, some of these things that were discovered by John Snow, Ignaz Semmelweis, Joseph Lister, and others were accidental discoveries. However, the scientific method is an extremely important process that allows scientists to critically understand the cause and effect of a specific factor. And it was the use of the scientific method that allowed scientists to then become more definitive in their assessments of the origin, transmission, and remedies of disease. The scientific method starts off by making an observation. Today, many of these initial observations come in the form of looking information up online of previous studies and knowledge in the community. When someone says they do internet research, this would be considered the first step of the scientific method. Based on these observations and internet or literature research, a scientist would then ask a question. Once the question is asked, scientists would then form a hypothesis. Importantly, a hypothesis is an educated guess. It is a statement that answers the question. And when I say it's an educated guess, it's educated based on the observations made before the question was asked. Also importantly, the hypothesis must be testable. And so you must be able to conduct an experiment based on this statement. Once the experiment is conducted, that experiment must include a control group and an experimental group. The control group would have factors that are similar to the experimental group with one defining difference. The factors that are similar to the experimental group are what we refer to as standardized variables. The difference between the control group and the experimental group is referred to as an independent variable. Out of the experiment comes the results. The results are otherwise referred to as the dependent variables. Based on the results, you would either accept or reject your hypothesis. These experiments should be repeated over and over and over again. And after millions of lines of experiments that all support the same hypothesis, we can then make a conclusion and provide what's now referred to as a theory. Theories are extremely well-supported ideas based on millions of lines of evidence, including the germ theory of disease that we'll talk about in the next chapter. I'd like to describe how the scientific method was used in the early 1800s by a very important individual, Edward Jenner. We'll spend about 5 minutes in the last section of this lecture talking about him.